Hello, my name is Sarah Philman, and I am the career coach working with pre-health students at University of Colorado, Colorado Springs. Today, we're going to talk about the application to medical school. Before we begin, these are the recently released application cycle numbers for 2023 matriculated applicants put out by the Association of American Medical Colleges. So I'll briefly share that. Because I think that's a really indicative of if you're ready to apply, what are the averages for applicants, what are the averages for matriculants, and a really good assessment of what the last application cycle looked like. So first of all, I work in the Career and Innovation Center here at UCCS. We are located in University Center 114, just down the hall from the bookstore. I help students with career exploration, all of career readiness, including resume, cover letter, interviewing, job searching, networking. I hold programming panels and events, career fairs, and work with students from freshmen to alumni. I primarily am working with all pre-health students or students interested in a healthcare field. This is an overview of what we're going to discuss in this presentation. So we're going to talk about the application services, the timeline, the academic information and metrics, testing requirements, the primary application overview, the secondary application, interviewing, the cost of the medical school application, and what do medical schools want, including more on the AAMC core competencies. So the centralized application services available are the American Medical College Application Service, which is specific to MD programs, AACOMAS, which is for U.S. Osteopathic Medical Schools or DO schools, and then the Texas Medical and Dental School Application Service, which is specific to medical and dental schools in Texas. So this is an overview of the timeline for applying to medical school. So for the 2024 to 2025 application cycle, it's going to open May 1st. That is when you can go into AMCAS, create a profile, fill in all of your information for the primary application. And then the application will go live and you are able to submit starting May 28th. I have this really cool graphic here, which I think is very helpful in lining up some of that preparation. So ideally, you would take the MCAT in the year that you are applying. So anytime from September through May is a good time to take your MCAT. So you get your scores back early for the application cycle. You're looking closely at that blue time frame because that is the ideal time. Ideally, you are submitting your primary application in early June. Because schools are admitting on a rolling basis, meaning that means as soon as applications start coming in, they are looking at those applications and they're already creating that yes pile for who they want to interview. As you wait closer to deadlines, that yes pile is pretty big. And so they are a lot more critical and picky around who they're going to invite for interviews. So your chances really go down significantly the longer that you wait in the application process. So being ready to apply in June is kind of the ideal time frame. You hit submit on the primary application, and let's say you choose 10 MD schools to apply to. You're going to submit. You're going to select those 10 schools in AMCAS and you submit the primary application and it goes out after you're verified to all of those 10 schools in one place. You're going to get secondary applications back from each individual school with questions based on what that program wants to ask. And then you're going to get interviews. Even last year, we saw interviews from September all the way to May. So that interview process is lengthened as well. And then admissions decisions start coming out. So you can get an admissions decision all the way into the following year. And so that application process in total can take almost a year. You're going to have to input all your academic information, which we'll talk more about the primary application in just a minute. But academic info on being ready to apply to medical school. consists of being on the pre-med track. So you can major in anything, but you just need to make sure that you take some core pre-med classes that really show competence in the areas that are required for applying to medical school. You'll see the course listings on the right, and these are in line with the CU Anschutz and what UCCS deems to be pre-med in accordance to what our CU system medical school requires. In AMCAS, you have to manually put in all of your academic information. AMCAS is going to calculate a GPA within the application service, and you'll also have to submit official transcripts through the UCCS registrar's office. It's also a really good idea to confirm in advance which programs you are applying to and if they accept AP credits, as well as what the class requirements are and what recommended classes they have as well. The testing requirements for applying to medical school are taking the MCAT. So the MCAT is divided into these 4 multiple choice sections. When to take the MCAT. So the MCAT is ideally taken sometime between January to May in the application, prior to the application cycle that you're applying in. But typically your MCAT scores will last for 2 to 3 years, depending on the program. You also have to take the ALTIS Suite or CASPER exam, and that's program dependent as well, but it is a situational judgment test, just designed to assess how you will behave in certain situations. And they really assess these 10 characteristics listed. And the AAMC preview, which is a little bit more new, and it is a professional readiness exam, another situational judgment type test that you also need to take, and more schools are requiring as well. So a primary application overview. So you are going to need to select the medical schools that you want to apply to. So the MSAR is the MD directory. The Choose DO Explorer is a DO directory of all of the nationally accredited schools that you can apply to in those application services. Things to consider when choosing the schools that you want to apply to are listed here. I would say the residence eligibility of those programs, meaning some schools are going to accept more in-state than out-of-state. That's something that you want to be aware of, and your citizenship status. The cost of those programs, the program type that you're applying for, the early decision programs, location of that program. So is it urban or rural? Is it close to a support network? The average GPA of matriculants getting into those programs and the average MCAT scores of matriculants getting into those programs. So I advise a lot of students to, when they're making their list, thinking about what are some reach schools, what are some target schools, and what are a good amount of safety schools that you want to apply to in the application. Is it a public or private institution? How do you connect with the culture of that institution and align yourself with their mission, vision, and values? Is it a research forward institution? And if so, do you have research experience? What are the clinical opportunities or specialties coming out of that program? What are the percentage of graduates accepted into residency programs? What's the class size? So some schools are accepting students in 80 seats. So their cohort will be 80 students. Some have 200 students. So that's something to consider. The community that they serve, are they serving a community hospital directly? And if so, and they really prioritize that community piece, do you have community service experience? And what kind of financial support and costs do they have? So these are just some considerations as you're building out your list of schools that you want to apply to. In the primary application, you will be assigned ID numbers, which are going to be important. And you're going to put in all of your biographical and demographic information, including your contact info, your citizenship, childhood, language proficiency, military service, ethnicity and race, parent, guardian, sibling info, and other additional information based on the school's requirements. You will list all of the schools attended, your high school information from which you graduated, and any and all post-secondary institutions will have to be listed in the application. You will manually input your academic history, so I always advise students to get an unofficial or an official transcript so that you have a guide as you're inputting your academic information. And you have to go through the UCCS registrar and the registrar's office for any post-secondary institution that you've attended to get transcripts. They get sent directly into AMCAS. You have to have all of your testing results submitted, and those go directly into AMCAS as well. And then a criminal background check is also conducted. Probably the biggest section for you to be aware of is the work activities experiences section. So applicants can add up to 15 different experiences, and you have to summarize each experiences with about 700 characters. You will be able to choose your 3 most meaningful or most impactful experiences, and you write a little bit more about each of those. You also have the ability to input experiences that are anticipated that you haven't done yet, but you are anticipated to do those, and you can explain a little bit about those. You have to quantify these experiences through the total number of hours completed in that experience and the start and end date as well. These are the 19 different work activities categories that you are able to categorize each experiences that you've had. And I always tell students to look closely at all of these different categories. I want you to take notice in that you can volunteer in a non-medical and clinical setting, and that is actually really encouraged. It's important to think about a cause that you care about. That brings me to a new category that was just listed for this cycle, and that is the social justice and advocacy category. Really thinking about what are some causes that you care about and how can you commit your time to those causes. Think about also what employment that you've had that even is not healthcare related, because that is also a valuable experience that you can put in your application. You have to submit a personal statement, and this is going to be an essay. It's 5,300 characters. That is characters, not words, so spaces are included in that. And this is about a page, a little over a page, and it's going to reflect your personal perspective and experiences that really answer the question of why you've selected to go into the field of medicine. What is motivating you to learn more about medicine? Why do you want to make an impact in this field? And other things that maybe you didn't include or disclose in your application already. You can talk too about any unique hardships or challenges or obstacles that have maybe influenced this decision or your educational pursuits. And really talk about and explain any fluctuations that you might have had in a class. If you are on an MD to PhD path, you will have 2 additional essays that you have to submit. Letters of recommendation are a really important part of your application, and you can submit up to 10, but typically no more than 5. Each school might have different letter of recommendation requirements that you want to be aware of. You are able to, the AMCAS service is able to electronically receive all your letters of recommendation directly into the application, so you never see your letters of recommendation or submit them yourself. Also, you can submit your application before all of your LORs are uploaded. They do not hold letters of recommendation, so if you don't get in one cycle and you want to reapply, you have to resubmit those letters of rec. UCCS does not have committee letters, so you will be selecting individual letters. Basically, what you'll do is you'll fill in the recommender's information, including their contact info. You will provide them a letter of request form, and that goes directly to your recommender, the author of your recommendation. You are going to make sure that your AMCAS ID and letter ID numbers are matched properly to your application, and then the recommender takes it from there. They go into AMCAS and submit their letter of rec. The secondary application overview, what is it? The secondary are going to be additional school-specific questions. So if you decided to apply to 20 schools, everything gets submitted through the primary application. So all of this is the primary application info that you will submit. You'll select all 20 schools and submit all that info, and it shoots out to all of those 20 schools once you're verified. If you apply to 20 schools, keep in mind, you will be getting 20 separate secondary application questions back. These are school specific and really help explain why you align with that school and how you're going to make a great medical student for that specific school. Each of these questions are going to be a little bit different, but there are resources where you can prepare for the secondary application questions ahead of time, and I encourage you to do so. And then hopefully you get to the interview stage. If you're invited for an interview, that means the school is very interested in you. They see your primary application and they do feel that you are qualified and you would succeed academically in their program. But now they're really trying to assess your character, your social abilities, your communication skills, and just want to learn more about who you are and how you are engaged and how you can engage in communication. So there are different formats for interviews. There are live in-person interviews. There are live virtual interviews. Now, post-COVID, a lot of interviews are virtual. These are typically 30 to 60 minutes. And you can be interviewed by multiple different people. There are also hybrids, meaning that you might get the choice of conducting an in-person or a virtual interview based on what you can, accomplish. And there are asynchronous or recorded virtual interviews, but these are also very rare. The types of interviews that you might find are as follow. First, you're going to get all of this information ahead of time. So basically, you will get contacted by the medical school, and they're going to navigate you through what the interview process is going to look like if you're invited for an interview. They have closed file interviews, open and partially open file interviews. Meaning if it's a closed file interview that the interviewer has not seen anything in your application and they don't know anything about you. Open file interviews means they've seen all of your application, they know everything, including the academic history, your personal statement, all of your experiences. And partially open file is typically means that they've seen maybe your personal statement or your activity section, but they have not seen any of your MCAT or academic information. There are one-on-one interviews where maybe a member of the admissions team, a faculty member at that medical school, or a local clinician, or a student even might be interviewing you one-on-one. There are group interviews, which consist of multiple applicants participating in one interview at the same time. These interviews are really assessing your interpersonal skills and how you conduct yourself in small group learning. Sometimes in group interviews, you might be presented with a task or a problem and you have to solve it together. There are panel interviews where maybe there are multiple interviewers with a single applicant or maybe a few applicants at a time. And then there are multiple mini interviews or MMI. And these are increasingly becoming more common with medical schools, and it consists of 6 to 10 interview stations, and you only have a few minutes in each, where you are provided a question or a specific scenario. And sometimes it's even theatrical, and there are actors that are part of the MMI, and you have to, in that small amount of time, problem solve, assess the situation, and see how you're going to overcome it or respond. An overview of the cost of the application. It can get very expensive depending on the number of schools that you want to apply to and the different application services that you're using. So for example, the primary application fee for AMCAS in the 2024 application is $175 for the first school, and then $45 for each additional school. As an example, if you apply to 20 schools, that primary application cost alone is over $1,000. You have secondary application fees based on each school, and that's program dependent. So typically it's between $45 to $100 each. You have college service fees, so getting that official transcript is going to have a small fee. The MCAT cost to take the MCAT is $330. The Alta Suite cost is $85. That's for 8 programs, but if you are sending that score to other programs, it costs an additional $15 per program. And so the typical cost for applying to 20 schools is over $3,000. And then I would say keep in mind that each application service has a fee assistance program, and I highly encourage all students to apply for that. You also need to plan in advance for when those application dates are. So all that being said, you get through the application process, but what do medical schools want? So this is a little bit about that. So they want authenticity. Being true to who you are, seeking out experiences that speak to you, what you want to learn about, what causes you care about giving your time to, and really staying true to you. They want students who will succeed in their program, and they're really assessing that through your metrics. They want students who are certain that this is the path they want to take, meaning, do you have healthcare experience? Have you worked in a healthcare setting? Have you worked with patients? Have you shadowed enough? Do you know enough about the industry that you're sure you want to go into it? They want a cohort that is diverse. That does not necessarily mean ethnic and racial diversity alone. That also means academic diversity, your educational diversity. What did you major in? What classes have you taken? Diversity in your experiences, diversity in where you come from and your background and your history. A cohort that's diverse is just better for everyone going through medical school. And that's something that they really take into account. They want students who are going to make good doctors socially, emotionally, relationally. And they want students who are committed to a life of service. How do they really assess these things? That is the AAMC Pre-Med Core Competencies. So this is updated as of 2024. One thing you'll notice within these core competencies is if you look to the right, you'll see living systems, critical thinking, scientific inquiry, human behavior, written communication. These are things they can really look at through your academic history and see that you are competent in these areas. But if you look more towards the left, these are more interpersonal and intrapersonal skills that they're going to assess and evaluate based on all the other experiences that you had and looking at you holistically as an applicant. So if you really want to know exactly what medical schools are looking for, these core competencies cover it all. And this is how they're assessing the applications. There is a healthcare career fair coming up. There's a little bit more about that, April 23rd in Burger Hall, and it'll take place in University Center. And that is all for this presentation. If you have any questions, please reach out to me at my email address. Absolutely check the career pre-health page for a lot of great resources to help get connected and prepare for that healthcare exploration, learning more about the medical school application and how else I can help. I'm happy to help and assist. If you have any questions, reach out. Thank you.